morning, I'm Paul Reynolds. My topic is laughter in medicine. I have nothing to declare. I am not a comedian. Thank you very much. My apologies. Clicker. I will try to be brief. And after all these heady topics, it's really great and phenomenal. I did a count. We had about 42 episodes of laughter and 3 phenomenal belly laughs during the 2 Dr. Edmonds and Ms. Trapp, and we did a tremendous job about saving our lives just then.
Yes, you did.
Okay, laughter. I'm a big fan of definitions and defining things. So please read a little bit of this, and I have an ask at the end. And there'll be 3 asks, all right? So pick one word of the second topic, and I want everyone here to use one of them in a sentence within the next week.
Okay.
Please. You can use 2 for extra credit, but I'm not counting. Okay, but laughter, it's a spontaneous sound and movement, both of face and body, that are instinctive expressions of lively amusement and sometimes also contempt or derision. So laughter. All right, please go ahead. So again, it is a physical reaction. It does do, actually there are some audible contractions of the diaphragm that one can hear. Can arrive from a number of different activities, being tickled, humor stories. There's positive emotions, joy, mirth. That's double credit if you use that. Expression of happiness. And on some occasions, for contrary emotional states, such as embarrassment, or driving on the south side of 101 near Big Sur, and you're afraid of heights. So the definition of laughter is actually gilotology. It comes from the Greek word gilos. Okay? Gilotophobia is the intense fear of being laughed at. Gilotophilia is, on the other hand, enjoyment of being laughed at. And catagileticism is the joy of laughing at others. Okay? That was not supposed to be funny. It is an F10 code for ICD-9, so for all of those that want to code for that, it is actually reimbursable. All right, a little busier slide, laughter. It does relax the whole body, not all sphincters. Laughter reduces the immune system. Laughter triggers the endorphins. It also burns calories, lightens anger load, and it may even help you live longer. There's actually a Norwegian study that actually had people that laughed actually live longer, and they actually documented that. So it does work for immune health. There are studies, and I have a brief bibliography at the very end about this. It does, watching a 1-hour comedy video, for example, was found to produce increased number and activation of T cells, helper T cells, the ratio of helper to suppressor cells, the NK kill cells, and the levels of gamma interferon, and the number of B cells. So immune health. Those of the medical students that are aware, the lymph channel is actually a passive channel. The diaphragm actually stimulates an increased negative pressure in the chest. It actually will stimulate an increased lymph flow throughout the body, up to 10 to 15 times with huge belly laughs. So by doing that, you actually are improving your health and well-being, and actually can help fight heart diseases and actually potential for future diseases. Endorphins. This is a study from Journal of Neuroscience. So it's actually somewhat professional journal. They did use a PET scan, and they actually showed increased PET deposition with times of laughter. Blood pressure. They did a study for the Journal of Dental and Medical Research that had 40 patients under HD having a comedy show, and they had a statistical lowering of their blood pressure versus those that were in neutral. Physical health. Laughter raises DHEA, and also as far as use of declining, for decreasing the decline with age, anti-aging, anti-cancer, and anti-obesity. Physical health. These were some of the earlier slides that were briefly looked at today. Physical health, to boost immunity, stress hormones, decrease pain, and obviously relax your muscles. Mental health, read that. Strength and resiliency, that's a common thread we've heard today. And social health, obviously strengthens the relationship. It's a community process. It also enhances teamwork and certainly group bonding. So, these have no copays. It does not require a pharmaceutical. It doesn't require a prior auth or a TAR or any other preemptive proceeding. And it comes in a number of different forms. So when you look at this, you can say yes in your practice. Yes, you can laugh. You can laugh with your patients. Privately laugh about your patients. It's not as healthy because it's silent. And as we mentioned about the endorphins. So, and then finally, those three things that we wanted to mention today. One is I want you to use one of those words in the next week. Number two, we saw that the health benefits of laughter was not whether you laughed at or laughed with or felt laughed at, but there was benefit for it. And number three, my final ask is, well, actually 3.5, I usually go 4. 3.5, thank everyone that you work with. Have a laugh with them because they will join your potty and your mowing. But the fourth thing I want you to do is the next time you get an email and you see the 3 letters, LOL, please do it. Laugh out loud. Thank you.